everyone. Thank you for coming and joining us today. My name is Jessica Velasquez, and I am a nursing student at Methodist University. I'm here today to speak to you about promoting a healthy pregnancy and a guide to nurses on how to provide education to patients about weight management and a healthy diet, especially concentrating on not eating for two. Just a little background information. In 2009, the Institute of Medicine and the National Research Council updated new guidelines for weight control and weight parameters during pregnancy. These are guidelines that had not been updated in over 20 years. Nurses play a vital role in promoting proper nutrition and weight management during pregnancy, which are essential for a healthy pregnancy. So the goal of this presentation is to empower nurses to provide patient education, to guide patients in making healthy, nutritious diet choices while remaining within the recommended guidelines. So why is this important? According to the IOM guidelines, few statistics that they found out during their research, 1 in 5 American women is obese at the start of pregnancy. Less than 1 in 3 women gains within the IOM parameters. About 1 in 5 women gains more than 40 pounds during pregnancy, which is more than any woman should gain at any weight. And about 50% of overweight women gain more than 30 pounds. Also, more than half of women say that they received no education or no counseling about appropriate weight gain during pregnancy from their practitioner. This is a gap that nurses can help fill and to provide that education that providers are not doing. So what are the benefits of a healthy pregnancy? One of the benefits of remaining within these parameters is it reduces the risk of complications during pregnancy. It also increases the chances of a healthy infant birth weight. It makes it easier for the mother to return to her healthy weight after delivery, which is good for the woman's overall health and also puts her on the right track for the next pregnancy. And also improves the long-term health for both the mother and the infant by establishing healthy lifestyle habits. So as a nurse, our responsibilities are to express the importance to mothers about healthy pregnancies and the risks of excess weight gain and a bad diet. And you have to emphasize the fact that just because you're pregnant does not mean you're eating for two. You have to also determine the pre-pregnancy BMI to establish expected weight parameters of weight gain. Also, you have to counsel the woman about healthy choices for diet and physical activity so that they can achieve their goals of weight gain during pregnancy and weight loss afterwards, and also help the patient track their weight during the pregnancy. So here are the guidelines that were established by the Institute of Medicine about weight gain during pregnancy. So it's based on the pre-pregnancy BMI, and so it's recommended for underweight women to gain between 35 to 40 pounds. For normal women to gain between 25 to 35 pounds, and for overweight women to gain 15 to 25 pounds, and for obese women to gain between 11 to 20 pounds. It's also suggested that women only gain 2 to 4 pounds in the first trimester, and then at a rate of 3 to 4 pounds per month in the second and third trimester. So the 2 essential components of diet during pregnancy are going to be a balanced diet and a focus on getting key nutrients. A balanced diet with a variety of foods can provide enough nutrients for pregnancy, and emphasis is placed on adjusting the diet to ensure intake of adequate nutrients for the mother and the baby. Key nutrients. So selecting these foods from a balanced diet will ensure that the mothers get the key nutrients, which are going to be folic acid, calcium, and iron as the top 3. So a little bit more information about nutrition for a mother. The caloric intake should only increase by 300 calories per day, and it's based on the activity level of the mom, and it ranges for caloric intake could be from 1,200 to 2,400. Also, safe food practices are very important because a pregnant woman is at a higher risk of foodborne illnesses, and extra calories from added sugar and fats can lead to extra weight gain, so you have to watch out for those and advise about that. So the components of a healthy diet are similar to those of everyone else. You have your 5 major food groups. You have whole grains, fruits and vegetables, lean proteins, dairy, and heartful fats. Heartful fats include things like vegetable oils, olive oil, peanuts, stuff like that. Okay, so the key nutrients that are needed during pregnancy are folic acid. Folic acid is very important because it reduces the risk of birth defects related to spinal cord. The intake that's required, that's needed for pregnancy, is 600 micrograms per day. And some sources of folic acid include fortified fruits, cereals, pastas, and breads, as well as green leafy vegetables and beans. Another key nutrient is iron. Iron deficiency is actually the most common nutritional deficiency during pregnancy, and mothers are required to have at least 27 milligrams per day. And the last key nutrient is calcium, calcium is needed for the healthy development of the baby's bones, teeth, heart, nerves, and muscles. And when the mother does not receive enough calcium in her diet, it actually pulls from her bones. So ensuring that the mother gets appropriate calcium during pregnancy is very important to prevent osteoporosis in the future. And you need 1,000 milligrams of calcium per day, and it should be obtained through 3 balanced meals of calcium-rich foods throughout the day. So we have here just a sample daily menu of a meal that a mother can have. You have breakfast, lunch, and dinner, and you have snacks through after each meal just to help keep a good nutrition. I've included here some few resources that are available to mothers and to providers to help establish a healthy diet and help mothers track their weight. The Institute of Medicine has a lot of resources available on their Healthy Pregnancy website, such as an interactive tool that you can guide mothers to use to establish their BMI and to teach them more about the importance of healthy diet. Also, it has a weight gain tracker that can be given to the mother and helps her track her weight throughout pregnancy, and also guidelines for providers on how to implement this into practice. The USDA also has an interactive tool where you can help you choose your diet and make meal plans according to your weight, age, pregnancy, and all that. All right, so that's all I have for you today. If you have any questions, I will be more than happy to answer your questions. Everyone, have a great day. Thank you.